Good morning, class. I'm going to talk to you about the reproductive system, and that is chapter 23 in your book. And as you note, under the title, the reproductive system is the only body system that doesn't become fully functional until puberty. The overview of the reproductive system is at the bottom of that page. No, the primary sex organs are called the gonads, and those are the testes in the males and the ovaries in the females. And then the gonads produce the sex cells, also called gametes, and these include the sperm in the males and the eggs, also known as ova, in the females. And then the secondary sex organs are the other organs that belong to those systems. That include ducts, glands, and the penis in the male, and then like the uterus and the fallopian tubes and things like that in the female. So we're going to start with the male reproductive system. On page 466, we start with the testes in the male, and the testes are suspended by a strand of connective tissue and muscle called the spermatic cord, and they hang behind the penis in a tissue sac called the scrotum. The spermatic cord contains the sperm duct, also known as the vas deferens, which we'll talk about coming up, the blood and lymph vessels and nerves. And there's two testes in the scrotum, and there's a median septum that divides the testes and keep them separated from each other. They're surrounded by a cremaster muscle, which surrounds the spermatic cord and the testes, and it helps pull them closer to the body when it's cold weather to maintain proper temperature, because temperature is very important for the survival of sperm. It can't be too hot, it can't be too cold. Life lesson at the bottom of 466 talks about undescended testicles, and that condition in newborn males we call cryptorchidism, and we always do an assessment to make sure that the testes have descended, and if they haven't, then these little boys are followed for that first year of life to see if they descend on their own, and if they don't, then they need a surgical procedure, because if we don't do anything, these boys can become sterile later in life, or it could possibly lead to testicular cancer. The key reason why the testes reside outside the body is because of that temperature issue I mentioned, and the Body at Work talks about that. The body itself is too warm for sperm, so the cremaster muscle will pull the testes closer if it's too cold, and drop it down further if it's too warm. Just remember, if you know of anybody who is a male who's trying to become a father and they're not having success, that they should watch that they're not wearing too tight-fitting clothing, that they're not getting into hot tubs and that kind of thing, because that can affect the survival of sperm. On page 467, then there's a cross-section of a testes, and as you can see, there's fibrous tissue in the testes that contain more than 200 lobules, and within each lobule you have 1 to 3 seminiferous tubules. These are tiny tubes in there in which sperm are produced. This is where sperm come from. And if you can see that in the picture, it kind of reminds me of ramen noodles, but that's how I remember what seminiferous tubules look like. The line between the seminiferous tubules are clusters of interstitial cells, also called Leydig cells, and that is where the testosterone is produced. And then if you look along the right-hand side of that page, it talks about what happens as the sperm is produced. It will go into a network of vessels called the rete testes, which lead away from the seminiferous tubules and provide a location for the sperm to start maturing. The efferent ductules conduct immature sperm away from the testes to the epididymis. And the epididymis, this is the one thing you need to really remember, is where the sperm matures. From the head of the epididymis to the tail, the sperm matures as it heads to the tail. And then in the tail, that's where they're stored. And they can be stored for anywhere from 40 to 60 days and still be viable. After that, if they're not ejaculated, then they will disintegrate and the body will reabsorb. The tail of the epididymis then leads into the vas deferens, and that is the tube that takes the sperm from the testicle up through the spermatic cord and away from the testes and into the body, and eventually to be leading out of the male. As the vas deferens turns up into the spermatic cord, it goes into the pelvic cavity, it loops over the ureter and descends down over the posterior bladder wall. And as it turns down there, it widens into this ampule and ends by joining to a seminal vesicle. Each ejaculatory, each seminal vesicle forms an ejaculatory duct. And it says there's 2 ejaculatory ducts, one for each testicle. That's what I was trying to say. And then the ejaculatory duct passes through the prostate, and then the prostate will empty it into the urethra. So if you look on page 468, I want you to get an idea of the passageway that the sperm goes. And 468 gives you a cross-section of the male body, and it shows you the vas deferens and how it loops up and where it joins with the seminal vesicles. The seminal vesicles are located at the base of the bladder, and these there's one for each vas deferens, and they secrete a thick yellowish fluid, and this accounts for about 60% of the semen, and it has a lot of fructose. And if you remember from A&P, fructose is a form of a carbohydrate, a sugar. And so this is an energy source that provides energy for sperm motility. So that's why it needs that part of the semen. It nourishes and ensures sperm motility. And then the prostate gland sits just below the bladder. So when the sperm and that part of the secretions from the seminal vesicle gets to the prostate gland, it sits below the bladder and it encircles the urethra and the ejaculatory duct. And this gland secretes a thin, milky, alkaline fluid. It adds volume to the semen. It comprises of about 30% of the fluid, and it enhances sperm motility. And then last but not least, you can see in the little green P-shaped areas there, it will join up with 2 bulbourethral glands, also known as Cowper's glands. And these secrete a clear fluid into the penile portion of the urethra during sexual arousal. And that provides a lubricant, but it also neutralizes the acidity of any residual urine that would be in the urethra, because in the male, the urethra serves both urinary and reproductive systems. So you want to make sure you take care of any residual urine that would be in there. The bottom of page 468 talks about prostate disorders, so read over that. It talks about benign prostatic hyperplasia, BPH. This is common in men who are aging, and the prostate will enlarge and cause issues with the urine stream, and also prostate cancer. Know that one blood test we look for prostate cancer is the prostate specific antigen, also known as the PSA test. So you can read over that. And then on 469, talks about all the different parts of the penis. You can read over that. I think that's self-explanatory. And then it gives a cross-section of that, talking about the 3 cylinders of erectile tissue within the shaft of the penis. During sexual arousal, that tissue will fill with blood, causing the penis to enlarge and become erect. And if you learned about any erectile dysfunction meds, you got to make sure that that an erection doesn't last longer than 4 hours, because the filling with blood will put constricture on the blood vessels that are supplying oxygen to that part of the body, and it can cause tissue damage and necrosis if that lasts too long. The Body at Work at the bottom of 69 talks about the hormones that are involved with the male reproductive system. Testosterone levels are rise for several weeks after birth, and then they start falling dramatically, and they're not really detectable for a while. But you have about age 13 is when puberty begins, and this is when you have the onset of the hormone production. Onset of puberty is marked by the secretion of gonadotropin releasing hormone by the hypothalamus. And then that triggers two other hormones, the follicle stimulating hormone and the luteinizing hormone. And get to know those two, because we'll talk about those females have those two hormones as well. These hormones promote enlargement of the testes, which is the first sign of puberty. Luteinizing hormone also prompts the interstitial cells to begin secreting the testosterone in the testes. So the increased production of testosterone then produces the secondary sex characteristics, which are listed there in the bulleted points at the bottom of 469. So you can read over those. I think you can come up with those pretty much on your own anyways. So then let's talk about the sperm. The Body at Work at the top of page 460. It's a process of mitosis. Remember, we learned that before. Is when you have two identical daughter cells during a cell reproductive phase. But with the reproductive cells, it doesn't do that. So you start the germ cells, which develop into the gametes, divide through meiosis, not mitosis, meiosis. And this is when a parent splits its supply of those 46 chromosomes into daughter cells that each have 23 chromosomes. So you have a sperm with 23 chromosomes, and then you're going to have an egg with 23 chromosomes. And so when it's fertilized, then those two come together, and then you have the 46 chromosomes to start the process all over again. So we do end up with 46 eventually, but the sperm and the egg have 23, and they come together to form 46. The bottom of page 470, there's an animation that goes with that. Talks about spermatogenesis, and you can read over that, but it gives you the idea of meiosis. Spermatozoa is at the top of 471 and gives you all the different parts. The head, topping the head is a cap called an acrosome, and that contains enzymes that allows the sperm to penetrate the egg during fertilization. You have the middle area that has a mitochondria that you need for energy to migrate where it goes, and then the flagellum, which is the tail. Testosterone is continually produced for the male throughout the male's lifespan. So men can produce children into old age. Testosterone controls spermatogenesis and supports the male sex drive. The bottom there talks about semen, and it gives, again, the makeup of semen. 65% comes from the seminal vesicles, about 30% from the prostate gland, and 5% from the bulbourethral gland, also known as the Cowper's gland. Each ejaculation expels 2 to 5 milliliters of semen with about 40 to 100 million sperm. And the two key qualities of semen include stickiness and alkalinity, which helps the stickiness helps the semen to stick to the walls of the vagina and cervix, and the alkalinity counteracts the acidity of the vagina. The life lesson at the bottom there talks about male infertility, and there's a lot of discussion about male infertility, and we've learned a lot about it. It's the most common form of male infertility is a low sperm count, and so the World Health Organization provides characteristics of what a normal sperm sample should have. And so if you're testing it, each ejaculate should have at least 2 milliliters and should contain at least 40 million sperm. And in that sperm, there should be at least 75% that are alive. So up to 25% could be dead. 30% should have a normal shape, and 25% should be swimming with rapid forward movement. At least 50% should be swimming forward, if only sluggishly. Any sperm count lower than 20 million indicates infertility. Page 472 talks about the male sexual response, and you can read over that. I think that's self-explanatory. Then 473, we get into the female reproductive system, knowing that the ovary is the main primary sex organ that provides the ova and the sex hormones. The ovary kind of does look white inside a female, and several ligaments, including the ovarian ligament and a sheet of the peritoneum called the broad ligament, kind of hold the ovaries in place. Each ovary at the bottom there has ovarian follicles that consist of an immature egg or an oocyte surrounded by follicular cells, and the follicles evolve during the fetal period, and they undergo mitotic division, and then the first phase of meiosis, and then they don't do anything until puberty starts. During the menstrual cycle, the hormone FSH, remember, follicle stimulating hormone, that comes from the pituitary gland. It prompts several follicles to resume meiosis, and so that follicle stimulating hormone will stimulate those follicles to develop. And you get a mature follicle, and then only one usually develops. One mature follicle, and it reaches the cervix, and it forms this fluid-filled blister called the Graafian follicle. So the Graafian follicle is that mature follicle that has the fluid in it. And then when we have a surge of luteinizing hormone that comes from the pituitary gland, we have the bursting of that follicle, which is what we call ovulation. That egg is released. And then you look at that picture, there's this yellow part called the corpus luteum. After the egg is released, that follicle then becomes the corpus luteum. The corpus luteum then is what stimulates the estrogen and progesterone development of building up the endometrial lining in the uterus in case that egg gets fertilized. So we'll talk more about that coming up later. On page 474, it gives an idea, look at what the internal genitalia look like. You have the fallopian tubes, also called the uterine tubes. The narrow isthmus is the portion closest to the uterus. Then the middle part of the tube is called the ampulla. That's the usual site. The middle part of the tube is the usual site of egg fertilization. You have cilia in there that kind of help move the egg along in the fallopian tube. And the distal funnel-shaped end of the fallopian tube is called the infundibulum. And that doesn't attach directly to the ovary. It looks like it's attached there, but it's not. And the outer portion has these fimbriae that fan over the ovary, and these fimbriae kind of catch that egg as it's released from the ovary and pulls it into the fallopian tube. The uterus itself has that upper portion called the fundus. Remember, the stomach had a fundus too, that upper rounded portion. Really important to know, because in level 3, we're feeling for funduses of pregnant women. The central region of the uterus is the body, and then the inferior end is the cervix, and that's the passage through the cervical canal that connects the uterus and the vagina together. The cervix secretes thick mucus during ovulation, and the mucus thins to allow sperm to pass. The vagina is a muscular tube about 3 inches long, receptacle for the penis and sperm. It also discharges menstrual blood and passageway of the birth of the baby. The vagina has rugae, and it allows for expansion, which you learned about with the stomach as well. And then at the bottom, the body at work, it talks about the layers of the uterus. The outer layer is the perimetrium, the middle layer is the myometrium, and the innermost layer, the endometrium, is where the embryo attaches. The top part is the stratum functionalis, and that's the part that anticipates receiving that fertilized egg. So it really thickens and gets ready. And if the egg isn't fertilized, then it sloughs off, and that's becomes the menstrual flow. The underneath layer is the stratum basalis, and that attaches the endometrium to the myometrium. And of course, you've probably heard of the condition called endometriosis, is when that layer doesn't slough and go down through the vagina, it goes out into the body, out other parts, and causes severe pain and scarring. On page 475, then, is the external genitalia. You can look over what those parts are, know what the Skene's glands are, and the greater vestibular glands are the Bartholin's glands. And then the breast parts there at the bottom of 475. Just fast fact, the amount of adipose tissue, not the size of the mammary glands, determines the breast size. Therefore, breast size has no relationship to the amount of milk a breast can produce. Because some people have that mixed up. They think if their breasts are small, they can't produce much milk, and that's just not true. 476 talks about breast cancer. Breast cancer is often associated by estrogen. Women who have a history, especially of family members who've had estrogen responsive breast cancers, need to be very cautious. People who are higher risk began menstruating before age 12, and will, as well as those who go through menopause after age 55. Women who've never had children or had them only after age 30 have an also increased risk. And then there's other risk factors listed there. It talks about the microbial community and the microbiome there in the middle, so read over that. And know the word menarche is the first menstrual period a girl would have. We call that menarche. So on page 476, this is kind of really important. It gives you all the hormones associated with the menstrual cycle. So basically, I'm going to try and explain this as best as possible. But you start out with low levels of estrogen and progesterone because a menstrual cycle just happened, and you have low levels of estrogen and progesterone, and that stimulates the hypothalamus to release gonadotropin releasing hormone. That gonadotropin releasing hormone stimulates the pituitary gland to release follicle stimulating hormone and luteinizing hormone. Follicle stimulating hormone is really in higher levels at the beginning of the menstrual cycle. So the beginning of the menstrual cycle, you're having menstruation, you have low levels of estrogen and progesterone because you haven't had a fertilized egg. So you have the gonadotropin releasing hormone, stimulates the pituitary to release follicle stimulating hormone. It's causing the follicle and the ovary to get excited and mature an egg to get ready to ovulate again, to be released. So you have the follicular phase is the very beginning where that follicle is getting mature. As that follicle matures, it secretes estrogen, which stimulates the thickening of the endometrial lining in the uterus. So the ovary is secreting the estrogen. The pituitary gland is secreting the follicle stimulating hormone and the luteinizing hormone. When you have a surge of the luteinizing hormone right around mid-cycle, that is when ovulation occurs. And so you have that egg released from the ovary. So that sudden spike in luteinizing hormone causes the rupture and release of the ovum, ovulation. And then the remnants of that follicle remain on the ovary and form that corpus luteum. So we had the Graafian follicle, which was that fluid-filled blister before ovulation. Ovulation occurs with that surge of luteinizing hormone. And then you have what we call this little yellow body. And if you look back on that page with the ovary, you can see what it looks like, the corpus luteum. The corpus luteum marks the beginning of the luteal phase. And the corpus luteum secretes large amounts of progesterone and also some small amounts of estrogen as well, in order to keep that and build up that endometrial lining in the uterus. The progesterone causes the endometrial lining to continue to thicken and become more vascular, getting ready for pregnancy. High levels of progesterone and estrogen inhibit the pituitary gland from releasing any more FSH and LH, because the corpus luteum is producing so much progesterone and estrogen, we don't need any more of the FSH and LH right now. And so we're getting ready for pregnancy. If fertilization doesn't occur, the corpus luteum starts to deteriorate and becomes a little piece of scar tissue called the corpus albicans. And as it deteriorates, it stops producing all of that estrogen and progesterone. So the dropping of the estrogen and progesterone will start that whole cycle again. You'll have the dropping of estrogen and progesterone. It's not going to be able to maintain that uterine lining. The uterine lining disintegrates and starts flowing out. Day 1 of the menstrual cycle is the first day of the menstrual flow is the first day of the menstrual cycle, is what I wanted to say. So when you have the uterine flow coming out, you have low levels of estrogen and progesterone because that corpus luteum died off, kind of disintegrated and deteriorate. It stimulates the gonadotropin releasing hormone to be released from the hypothalamus again, which stimulates the pituitary gland to release follicle stimulating hormone and luteinizing hormone, and we start the whole thing all over again. So get to know page 477, you need to know your hormones. And then on page 478, it talks about the menstrual phase. This is what's happening at the same time. So phases of the menstrual cycle, day 1 to day 5 is when the menstrual flow is occurring. Day 1 is when you first notice vaginal bleeding. And then the proliferation phase is from 6 to 14 days. Menstruation ceases. You have only the stratum bassalis in the uterus. And there's starting to have rising levels of estrogen secreted by the ovaries because the follicle stimulating hormone is starting to work and starting to stimulate a follicle to develop. And so the endometrial lining starts to thicken a little bit. And then you have ovulation occur, and then you have the corpus luteum really producing that estrogen and progesterone to get that lining really nice and thick and get ready for pregnancy again. And then you have the premenstrual, where if there's no fertilization, that uterine lining starts to disintegrate and gets ready to be flushed out. And then on page 479, it gives you a picture of what the ovarian cycle looks like and the menstrual cycle all at the same time. So you can see how the ovary is stimulated with the follicle stimulating hormone, FSH, and LH, the surge in LH rate at ovulation. And you can see at the same time what is happening in the uterus. So get to know those charts. And then at the bottom, the life lesson, aging in the reproductive system. Of course, we think of menopause during this time when you have declining estrogen and progesterone levels. The ovaries gradually stop producing that. And then you have the uterus, the vagina, and the breasts begin to atrophy. There's vaginal dryness. And so read over what the signs and symptoms of menopause are. And then page 480, the female sexual response. I'm not going to get into too many methods of the birth control. You can look that over. We discuss that in more detail in level 3. Thank you.